The U.S. Secretary of Veterans Affairs says he expects to see a surge of requests from veterans who delayed seeking medical care during the pandemic. Here's Secretary Denis McDonough detailing that in Congress last week.
Because of COVID, many veterans, like other Americans, have delayed health care, including mental health care. When they return, their conditions may be more complicated because of those delays. COVID impacts are broad, from healthcare delivery to benefit determinations. But with the American Rescue Plan, help is here, help that will significantly ease many pandemic-related challenges.
The Secretary also mentioned plans to tackle a backlog of compensation and pension claims, as well as setbacks with implementing the VA's new electronic health record system. For more on all of this, U.S. Veterans Affairs Secretary Denis McDonough joins me now from Washington. Mr. Secretary, thanks very much for being with us. How is the VA preparing for a potential surge in requests from veterans who did put off medical care during the pandemic?
Well, thanks so much for having me. We're preparing for this in a number of ways. Over the course of the last year, as many as 20 million appointments have been changed or postponed. In well over 90%, if not over 95% of those cases, we've stayed in close touch with those veterans to make sure that they're getting what they need and making sure that we're then preparing for further on requests. During this time, by the way, emergent care requirements were handled quite efficaciously, quite quickly, efficiently, because, for example, an average case of an emergency call was handled, within a day and a half, less than a day and a half of addressing that question. So it was fully closed out. So we're preparing for that, but then also now with this increased assistance from the President and from Congress, the American Rescue Plan, we have over $14.5 billion to prepare for the kinds of needs that your question suggests, and that the kinds of needs, by the way, that we're seeing across healthcare throughout the U.S., not just through VA, but through private hospitals, private healthcare, and other healthcare systems. So we feel like we're ready for it. We feel like this additional assistance from the American Rescue Plan bodes well for us to be able to handle it, and we'll be working this really hard.
So you answered my next question here, but since March of last year, compensation and pension claims have increased from 76,000 to more than 200,000 now. And so the plan you're saying is to use these billions of dollars from the President's American Rescue Plan for those claims. How else is that money going to be spent?
Yeah, so just on what we call the C&P exams themselves, we're increasing the ways that veterans can get those exams accommodated, be that coming into the VA facilities, be that over telehealth, or be that with private providers where they can get those exams completed. And once those are completed, then we can go ahead and complete the claims. The claims backlog is over 200,000 cases now. And with the additional assistance from the American Rescue Plan, we're going to reduce that by more than half to ensure that veterans are getting the benefits that they've earned. So that's on what we call the C&P exams. There's a big priority. We're moving out aggressively against that. Other parts of the American Rescue Plan include making sure that veterans who are in trouble with mortgage payments or utility payments, or even some that are in trouble with their rent because of the tight economy, can get assistance to make sure that they don't end up homeless. And then lastly, we also have a very exciting opportunity where veterans unemployed due to the pandemic can be trained in high demand skills for high demand jobs. So we'll be getting out there with more information on that in the next several days. But these are the kinds of investments that we think our veterans deserve, given all that they've done for us.
Following the passage of the VA Mission Act of 2018, former VA Secretary Robert Wilkie laid out plans to allow more veterans to seek care from private providers, which would be reimbursed by the VA. Is that something we should expect to see more of, an increased reliance on the private sector?
Well, it's really interesting. That act really said what should drive the decision about whether the veteran gets care in the VA system or gets care in the private system is the best outcome for the veteran. So that's what we should continue to drive for, which is what is the best outcome for the veteran? You've seen a lot of really exciting things just in the last week where Congress unanimously, that is to say every Republican and every Democrat, voted in favor of the VA getting additional authority to give vaccinations to veterans, their spouses, and their caregivers. That's a vote of confidence in the VA system. And we're seeing a lot of very positive stories about veterans pleased with the care they're getting as it relates to vaccination and other questions. So what we're going to do is let's let the best medical outcome for the veteran drive this question, and we'll see how that shakes out. What we're going to continue to do, though, is talk clearly and candidly with Congress about this. And again, at the end of the day,
do you see benefits, Mr. Secretary, in the private sector?
Really define this.
Do you see benefits in the private sector?
Do I see benefits in the private sector of increased care for the vets?
Allowing that's right, yes. I was asking if there are advantages that you have seen or that you've been told about with these opportunities for veterans to seek private sector care.
Definitely, yeah. We see some vets saying that they really appreciate the care that they get in the private sector. We see vets saying they really appreciate the care they get in the VA sector. And that's why we want to let best medical outcome drive this question rather than kind of bean counters in Washington trying to say this is what should happen, either direct them specifically to one system or the other. I think that would be a mistake. I think we should drive best medical outcome for the vets. We should focus on what increases access for vets, what betters outcomes for vets. That's what I intend to do.
So data shows residents in VA senior living facilities were half as likely to contract COVID-19 as people living in non-VA facilities. They were 13 times less likely to die from it. What are they doing differently?
You know, it's I think it's something that the VA and the United States should feel really proud of, which is that actually the practices put in place during the pandemic in our retirement homes did save lives for our senior vets. Other systems performed less well. So we're looking at now at what are the lessons learned from our VA facilities and how can we share them and apply them in other facilities. But again, this is a good example of VA innovation, VA collaboration across the integrated system, drawing lessons from the medical practitioners, from the scientists on how best to care for our vets. And that's one instance where I think the VA, going back to the last administration, has a lot of reason to be proud of their work.
In December, at a meeting of top military surgeons, the executive in charge of the Veterans Health Administration described the VA's workforce as, quote, tired and mentally exhausted. Dr. Richard Stone also expressed a concern about a potential wave of retirements in late 2021. How is the agency working to combat worker fatigue during the pandemic?
Well, one is, when we see the kinds of outcomes that we're seeing, that suggests not only are they continuing to fire on all cylinders, but they're continuing to innovate. And again, I hearken back to this unanimous, every Republican, every Democrat vote in favor of giving us additional authority to take care of vaccinations for our vets, spouses, and caregivers. I'm very proud of that. Second, we got to make sure that we're making VA kind of place where people want to stay. People want to continue to work here, drawing on the great opportunities in this great mission, which is, frankly, the best mission possible, caring for our vets. And then third is we have to be really aggressive using the tools that we have to recruit new talent into the VA. We've seen some good progress on that, but we need to continue to work that. Those are the kind of three things I'd say about that question in particular.
Before we let you go, today is National Vietnam War Veterans Day. What is your message to the men and women who served in Vietnam?
Well, thanks so much for that question. And we've been working this all day. And my message is, on behalf of a grateful nation, thank you and welcome home. And we hope that today, of all days, but really every day, you're getting now the thanks, the appreciation for your remarkable service on behalf of the nation that maybe you were denied before. So what I say on behalf of a grateful nation is thank you and welcome home.
Secretary McDonough, thank you very much for your time.
Thank you.